Social safety nets refer to social assistance programs that provide donations in cash or in kind, bringing together a set of free services. A total of 19 pilot projects have been implemented in the 15 Ecowas member states, with the objective of strengthening the living conditions of households in vulnerable situations. The Regional Support Programme for National Safety Nets in West Africa was implemented by the Regional Agency for Agriculture and Food, with financial and technical support from the Spanish cooperation. These pilot projects, whose implementation started in 2016, have had a real impact on the lives of the various beneficiaries. The achievements can be noticed in particular in the following 4 areas. First, food distribution, childhood development and access to basic social services, with significant results in Benin, Burkina Faso, Cape Verde, Senegal, Liberia and Togo. There's also the main development source of income and food security for vulnerable households. The results in this area are particularly visible in the Gambia, Guinea, Guinea-Bissau, Nigeria, Senegal, Sierra Leone, Burkina Faso and Niger, to name but a few. Additionally, there's also the strengthening of livelihoods and vulnerable households and their resilience capacity, so as to cope with shocks, as carried out in countries like Ghana, Côte d'Ivoire and Cape Verde. There's also the development and testing of targeting methods. The benefits in this sector have been documented in countries like Burkina Faso, Niger and Mali. Other achievements include, among others, the empowerment of women and capacity reinforcement in the management of social safety nets programs linked to national social protection strategies. The 19 pilot projects have made a positive impact on the lives of 53,349 direct beneficiaries, 62% of whom are women. These beneficiaries are sometimes individuals, groups, households, family farms, municipalities, villages or neighbourhoods. The Ecowas Commission remains convinced that the actions of social safety nets make it possible to sustainably preserve the most vulnerable populations' capacities to protect their livelihoods and develop their resilience in case of various shocks. Lessons have been learned from the implementation of these pilot projects. For example, even small initiatives make it possible to positively impact the lives of beneficiaries because they're well designed and targeted and not too complex. In addition to this, collaboration with state services facilitates a better inclusion of innovative actions in public policies and in implementing social safety nets and social protection. Combining social safety net instruments and taking into account socio-environmental conditions make it possible to obtain better results in terms of improving the resilience of vulnerable households. Finally, greater consideration of gender in targeting vulnerable families makes it possible to respond effectively to household food and nutrition problems. On the one hand, achievements recorded in the field and the lessons learned from the 19 pilot projects orient the reflection towards the promotion of some mechanisms of social safety nets, such as the integrated school canteen model, with the supply of local products and the promotion of agroecology practices, the conception of social safety programs adapted to the pastoral context, cash transfers combined with support measures for production, support for income-generating activities for women, and the enhancement of their role in food and nutritional security. On the other hand, the current coronavirus pandemic has become a real challenge for Ecowas and its member states and created the need to mobilise the most appropriate social safety nets to take care of food and nutritional security of the most vulnerable populations in the region. Otherwise, the stability of the region, which is already facing several challenges, notably insecurity, could be further weakened.